It's challenging working in mental health services, and implementing a smoke-free policy is not easy. It can feel like there are a lot of barriers getting in the way. Let's explore some ways to overcome them and make sure that we are doing the right thing for service users.
Smoking is a choice.
Smoking is an addiction, not a choice. If someone was addicted to alcohol, we would not let them drink under our care. We would find an alternative way to support them. We should take the same approach with smoking. Wherever you work, inpatient or community services, please use the opportunity to support service users to find other ways to manage their nicotine addiction. Nicotine replacement therapy and behavioural support are known to be effective and safe. Increasingly, some people are finding e-cigarettes helpful in managing their nicotine addiction.
I smoke. How can I tell someone else not to?
It is recognised that this can make people feel conflicted. However, as health professionals, it is our role to promote healthy behaviours, and we should not enable addiction to any substance, including tobacco. Have you thought about quitting yourself? As an employee of the Trust, you have access to a range of help and support, and you can find this by clicking the Smoke-Free button on TrustNet.
Service users have a right to smoke.
The view that service users have a right to smoke has not been upheld legally. The NHS is legally obliged to provide an environment that does not pose a risk to employee and service users' health. Smoke-free environments protect staff and non-smoking service users from the harmful effects of second-hand smoke.
Denying service users cigarettes will worsen their mental health.
Research studies have shown that this does not happen, and in the longer term, stopping smoking leads to an improvement in people's mental health. Quitting can reduce the risk of low mood, anxiety and alcohol dependence. It is possible to support people with mental illness to stop smoking without making their symptoms worse.
Cigarettes are really helpful in de-escalating situations when service users are stressed.
They may appear to calm people down, but by letting people smoke, we are actually helping them stay trapped in the cycle of addiction. Nicotine controls our dopamine levels, which affects our feelings of pleasure. Smoking lowers our dopamine, and then you need another cigarette to bring it back up again. This means we are trapped in a cycle of craving, and cigarettes are controlling how we are feeling. We need to draw a line under the belief that smoking is therapeutic for mental health service users.
Stopping service users from smoking will make violent incidents soar.
There is no evidence for this. In fact, some NHS trusts have significantly reduced levels of violence and aggression since implementing their smoke-free policy. One trust reported a 39% reduction in violent incidents in a year. If someone is becoming agitated as a result of nicotine withdrawal, we should make sure we're giving them enough nicotine replacement therapy to manage their cravings and offer them behavioural support.
Stopping service users from smoking is less of a priority than meeting their mental health needs.
Although we are focused on the immediate priority of managing a person's mental health, we must also think about their physical health. Smoking has a devastating effect on psychiatric service users and is the leading cause of preventable deaths in this group of people. This really isn't fair, and we have a duty to do something about this.
We are too busy to take the extra step of encouraging service users to stop smoking.
We know how busy everyone is, but how much time was spent on taking people out on smoking breaks? This time would be much better spent on staff training and supporting people to stop smoking.
Service users will be bored to tears without cigarette breaks.
Boredom can be difficult to manage, but this should not be addressed with something that causes harm. Instead, we should be looking at putting in place more meaningful activities, such as guided relaxation or fitness groups.
Smoking is a social activity on the wards. It helps staff and other service users bond.
Smoking can drive some really antisocial behaviours, such as violence, coercion and threats among service users. Having a smoke-free environment removes this issue and helps to keep our most vulnerable service users and staff safe. Additionally, smoking is increasingly socially unacceptable, so by facilitating smoking, we are maintaining stigma in a group of people who are already stigmatised.
I know that most service users do not want to quit.
Contrary to popular belief, people with mental illness often do want to quit. After an admission to a smoke-free facility, people have smoked less and feel more motivated about the possibility of quitting. It is easier to quit in a smoke-free environment. For service users who do not want to quit, managing their nicotine addiction without tobacco cigarettes during their admission can positively influence their thoughts about quitting.
Enforcing the policy is impossible when people are on different leave arrangements.
This can be challenging, but not impossible. Ideally, this should be addressed during assessment and care planning. Service users should be supported and encouraged to remain smoke-free whilst on leave, and cessation support put in place for their discharge.
We need help to help service users to quit.
There is lots of support available. Please make sure that you have completed the brief advice training on Training Tracker. You can signpost service users to the Quit Squad 0800 328 6297. Nicotine replacement therapy is very effective in managing people's cravings. It is important to provide this alongside behavioural support. The Quit Squad can provide you with training to do this. Some inpatient service users may use disposable e-cigarettes, subject to a risk assessment.
So we have seen that it is not always easy and there are challenges to overcome, but it is possible. If we focus on what we can do and support each other to be smoke-free, we can improve the mental health and physical health of our service users. Together, we can do this.
You can find out more about all of these things by pressing the Smoke-Free button on the homepage of TrustNet.